We're the nation's largest grassroots mental health organization dedicated to building better lives for people with mental illness and their families. We're here to talk about the barriers and challenges people face, but also the opportunities for the future for people with mental health conditions and their families, new treatments, new ideas of how we can serve them better. I'd say we've made progress, but the stigma still remains. So I think that we've come a long way. Particularly among younger people, we're seeing a more openness to talking about these conditions as any other health conditions, but there's still a fair amount of that shame and discrimination that's stopping people from getting the help that they need. We like to call mental illness the no casserole illness, meaning that if you get heart condition or you go to the hospital for something else, people bring you casseroles, they can't wait to support you. With mental health conditions, someone goes to the hospital because they're severely depressed. People are worried, they don't know what to say. They don't always reach out and support somebody. So we like to tell people, treat it like any other health condition. Just tell somebody you care and bring that casserole. Well, it depends on the condition. Some conditions it's more likely to occur with certain people, but generally I would say mental health conditions affect 1 in 5 Americans, so they affect a lot of folks. Yes, we're talking about depression, anxiety, bipolar disorder, schizophrenia. There's a wide range of conditions that we consider mental health conditions. First, it's getting people to seek treatment when they have these conditions, because as we talked about, there's shame, there's discrimination, there's also cost involved. What we see is that many times mental health care is not covered by insurance companies to the same extent as physical health care, meaning that it's often out of network. And what I say is out of network is often out of care because it's too expensive. So it's both, and there's a shortage, a great shortage of mental health professionals. I would say in any other condition, I really can't imagine that in half the counties of this country you could have a shortage of oncologists or cardiologists, but we see widespread shortages, particularly in child psychiatry. I think it's even more acute in psychiatry. One of the areas that we're exploring is telepsychiatry, but there are some barriers with licensure and other kind of regulatory and legal barriers that need to be addressed for this to be more used. But we're seeing some use of that, and also primary care doctors working with psychiatrists to be able to serve more people. So there are some good beginnings of ways that we can spread that resource, but we certainly need to do more. And we also recommend that people make use of community resources like NAMI, and we offer free educational classes to people with mental illness and their families. And we often work with physician groups to say, refer people to us as well, as a complement, not a substitute for treatment. I think there are a number of conditions that desperately need more care. So for example, suicide rates have gone up, and we know that 90% of those suicides involve depression. So that's an area we need to be concerned about. Schizophrenia, NAMI is working very hard to have more early intervention programs so people can get the help they need early and avoid some really bad outcomes. So I'd say across the board there's really need for more. We advocate, right? In Capitol Hill right now, there are some bills around mental health reform that NAMI's working really hard along with APA and our other partners to try to get these things moved forward. Some of the provisions in the Senate bill, for example, would strengthen parity enforcement, and that would certainly help. So we advocate, we bring together our folks to raise their voices to say we need change. You approach it the same as you approach other chronic conditions. So these are chronic conditions, so you have to have care that comes and provides care to the person and then might need to provide care again. People's symptoms come and go, they get worse and better, and you need to be concerned about that. So these are chronic conditions, and I think that makes them a little bit different. Another issue that you didn't talk about is they onset early. So 75% of these conditions onset before age 24. So it is a chronic condition, but it's a chronic condition that begins early. And that has implications because we want to catch these things early and make sure people get the help that they need throughout their life. Well, I think new and better treatments are on the horizon. There's a lot of exciting research going on, new medicines that are coming out, new ways of delivering care. So I think that there's a lot of promise. Technology is going to be used more in our field. So I think there's a lot of promise, but there's also a fair amount of barriers, particularly when it comes to people actually being able to access those things.